Welcome to the deep dive. Today, we're tackling a topic that really gets to the core of how we experience our own bodies and minds.
Yes, the whole idea of excessive health worry.
Exactly. We've looked through quite a bit of material history, clinical stuff, how diagnoses have changed, treatments.
Right, the whole spectrum.
The goal is really to unpack this condition. It's often misunderstood, so we want to give you a clearer picture of what it actually involves.
And you might be listening for any number of reasons, maybe understanding something you're dealing with or just curiosity.
Yeah, we just aim to provide some solid insights, without making it too overwhelming.
And it's worth saying right off the bat, this condition hasn't always had the same name.
Oh,
It's
yeah.
been called hypochondria, that's the classic one. But also health anxiety, illness anxiety disorder, even somatic symptom disorder sometimes.
Okay, quite a few labels.
But the common thread, it's this persistent, really intense fear of having a serious illness or maybe developing one.
And this fear sticks around even when doctors say you're okay.
Precisely. Even with medical reassurance, the anxiety doesn't just disappear.
Okay, so at its heart, what are we really talking about? What's the essence of this experience?
Well, fundamentally, it's this excessive worry, real distress about potentially having a serious illness.
And it comes from misreading your own body.
Yeah, basically misinterpreting normal bodily sensations or maybe even mental ones. And the key thing is, it's not just a quick worry that goes away.
It lingers.
It lingers, causes real distress, even after medical checks come back clear. Or sometimes there might be a minor issue, but the worry is just way out of proportion.
So the reassurance from doctors doesn't quite land.
It might help for a little bit, maybe, but it doesn't usually resolve that deep underlying anxiety.
And the term hypochondriac, that's the word people often use, right?
It is. Historically, that's the term for someone going through this. They tend to get really alarmed by, physical or even mental symptoms that others might just shrug off.
Even minor things.
Yeah, pretty insignificant stuff sometimes. They can become convinced they're seriously ill right now or that a bad diagnosis is inevitable.
Are there specific symptoms people tend to fix on?
Often, yes. People might really zoom in on particular feelings.
Yeah.
It could be digestive issues, weird gut feelings.
Like butterflies, but interpreted negatively?
Kind of, yeah. Or noticing their heart beating, maybe feeling muscle fatigue, that kind of thing.
Okay.
And interestingly, some of the older diagnostic rules,
Hmm.
they required these symptoms to be around for at least 6 months before even considering a diagnosis like hypochondria.
6 months, wow. That really paints a picture of persistence.
Yeah.
So how has the medical world actually, classified this over the years? Sounds like it's evolved.
Oh, absolutely. The way it's been categorized has definitely shifted. The ICD-10, the International Classification of Diseases, lists it as a mental and behavioral disorder right now.
Okay.
But the DSM, the Diagnostic and Statistical Manual of Mental Disorders, that's where you see a really interesting journey. DSM-IVTR, called hypochondriasis, a somatoform disorder.
Somatoform, meaning the mind's distress shows up as physical issues.
Exactly. Psychological distress manifesting physically. Back then, they figured it affected maybe 3% of people visiting their primary care doctors.
3%, that's not insignificant.
No, it's not. But then came a really big change with DSM-5 in 2013.
What happened then?
They essentially got rid of the hypochondriasis diagnosis. It was replaced by 2 new categories.
Okay.
Somatic symptom disorder that captures about 75% of people who would fit the old hypochondriasis criteria, and illness anxiety disorder for the other 25%.
So a split based on what exactly?
It's a more nuanced look. Somatic symptom disorder focuses more on the distress caused by the physical symptoms themselves, whether explained or not. Illness anxiety disorder is more about the intense anxiety about having an illness, even with few or no symptoms.
Ah, I see. That's a clearer distinction. What about even earlier DSM versions?
Way back, hypochondriasis was actually classed as a neurosis. Now, somatic symptom disorder is under somatic symptom and related disorders.
And illness anxiety disorder.
That one's interesting. It's listed there too, but also as an anxiety disorder, which really highlights that anxiety component.
Right.
And the newest ICD, ICD-11, actually puts hypochondriasis under obsessive-compulsive or related disorders.
OCD related because of the repetitive thoughts.
Yeah, pointing to that intrusive, recurring nature of the health worries. It shows how the thinking is evolving.
So lots of different classifications, but it seems like anxiety is becoming a more central theme in how we understand it.
Precisely. Since around the 90s, there's been this definite trend, viewing it more as an anxiety issue.
Using terms like health anxiety.
Exactly, health anxiety, or sometimes even health-related OCD, again, bringing in that idea of recurring worries and checking behaviors.
That makes a lot of sense. So, okay, if someone is experiencing this, what are the main signs? What does it look like day to day?
The core things really revolve around constant self-checking, self-diagnosis too.
Always monitoring their body.
Yeah, a real preoccupation with their body, noticing every little thing. And a big one is often distrusting doctors' opinions.
Even after tests and exams.
Right. Even when evaluations are thorough and doctors say, look, there's no serious condition here, that reassurance often doesn't stick,
Hmm.
or it's just not fully believed.
That sounds incredibly frustrating for everyone involved, really.
It absolutely is. And you know the term white coat syndrome.
Yeah, blood pressure going up at the doctor's office.
Right. People with significant health anxiety often get that heightened anxiety. Not
Mm.
just at the doctors, but even just thinking about appointments or being near a clinic.
Okay.
And they often need a lot of reassurance, not just from doctors, but maybe family, friends. Constantly asking, does this look okay? Do you think this is serious? It can be quite exhausting.
And behaviorally, does this worry lead people to constantly seek medical help or maybe the opposite?
It's interesting, it can go both ways. It seems contradictory, but it makes sense when you think about the underlying fear.
How so?
Some people become so afraid of illness, or what a doctor might find, that they avoid medical care completely,
Hmm.
even if they have real symptoms needing attention,
They're too scared of the confirmation.
perhaps, or just the whole medical environment. But then others do the opposite, frequent visits, seeing multiple specialists, pushing for more tests, more opinions.
Doctor shopping almost.
It can look like that.
Yeah.
And then there's another group who worry intensely, but might not actually talk about it much at all. They keep it internal.
So, a real spectrum of how it shows up. That's important to realize. And you mentioned something earlier, or it was in our notes, about life expectancy. That sounded quite serious.
Yes, that was a notable study.
Hmm.
Published in JAMA Psychiatry, December 2023, it looked at a large group, over 40,000 people.
And what did it find?
It found that individuals who had been diagnosed with hypochondriasis had, on average, about a 5-year shorter life expectancy compared to those without the condition.
5 years shorter. Wow. Why would that be?
The study pointed towards higher risks from both natural causes, like cardiovascular disease, and unnatural causes, including suicide. It really underlines that this level of chronic anxiety isn't just distressing. It can have tangible impacts on overall health and, tragically, mortality.
That's a sobering thought. It really drives home that this is more than just being a worrier. Now, the term somatic amplification came up. Can you break that down for us?
Yeah, somatic amplification is a really useful concept here. Health anxiety is often seen as a disorder of, well, both perception and cognition. Somatic amplification is key to that.
So it's about how you perceive and think about physical sensations.
Exactly. People with this condition are often hypervigilant. They're paying very close attention to any physical or even mental sensations.
Like tuning into background noise that others ignore.
That's a good analogy. And when they notice something, even something totally normal or minor, they tend to interpret it negatively, often catastrophically, leading to a lot of distress.
Can you give an example? How might that play out?
Sure, like someone might have a tiny cough. Most people wouldn't think twice.
Right.
But someone with this heightened anxiety might immediately think, oh no, this is pneumonia or TB or something even worse. Or, normal stomach gurgles might be taken as a sign of a serious intestinal disease.
So it's like the volume dial on normal body signals is turned way up.
Turned way up, and then the interpretation filter is set to potential disaster.
That makes sense.
And remember that contrast we talked about. Some people overmonitor and constantly seek help, while others, fearing what they might find, avoid doctors entirely, which could mean neglecting actual health problems.
A real double-edged sword.
Definitely.
Yeah.
And for many, this leads to real despair, sometimes clinical depression. They might feel convinced they have some terrible, untreatable illness that doctors just aren't finding. Some even feel like it's a kind of punishment.
That sounds incredibly isolating and difficult. Does health anxiety usually come alone, or does it often travel with other conditions?
It very often exists alongside other psychological conditions. There's a significant overlap.
Like what?
Things like bipolar disorder, clinical depression, definitely OCD, obsessive-compulsive disorder, also phobias, somatization disorder, panic disorder, generalized anxiety disorder. It's quite common to see these co-occur.
The OCD connection seems especially strong with the repetitive worries and checking.
Absolutely. That cycle is very common in health anxiety. You get these intrusive, scary thoughts about illness.
And then you feel compelled to do something to feel better.
Right. Compulsive checking, examining your body, searching symptoms online constantly, seeking reassurance again and again. It looks a lot like OCD.
Is there a way to tell the difference between health anxiety and, say, health-related OCD?
It can be tricky, but often the focus of the fear is a bit different. In what we're calling health anxiety or illness anxiety disorder, the main fear is usually about already having a specific illness.
Okay.
Whereas in some forms of health-related OCD, the fear might be more about getting sick in the future, or maybe contaminating others, or focusing intensely on germs and prevention. The core fear can subtly differ, even if the behaviors look similar.
That's a useful distinction. And the link with general anxiety or depression, how does that play in?
That's really important. Often, people with health anxiety might not fully realize that depression and anxiety themselves can cause a whole range of physical symptoms.
You mean the anxiety causes physical feelings?
Yes, things like fatigue, appetite changes, weight changes, dizziness, shortness of breath, numbness, tingling, headaches, stomach issues, even things like low-grade fever or itching sometimes.
Wow, quite a list.
It is. And so someone feeling these things because of their underlying anxiety or depression might misinterpret them as proof of a separate, serious medical illness.
Which then fuels the health anxiety even more.
Exactly. It becomes this vicious cycle. The psychological distress causes physical symptoms, which are then seen as evidence of physical disease, which increases the distress. Round and round it goes.
No wonder people get frustrated if doctors can't find a clear medical cause for those symptoms.
Absolutely. Especially if they're experiencing very real physical discomfort from medically unexplained symptoms, and they're desperate for relief and answers.
This is clearly so complex. What about the roots of it? What makes someone more likely to develop health anxiety? Are there known causes?
It seems to be a mix of things. Like most complex conditions, there's probably a genetic component, but it seems moderate. Heritability estimates are around, say, 10 to 37%.
So genes play a role, but maybe not the biggest one?
It seems that way. Non-shared environmental factors appear to be more influential,
Meaning?
meaning the unique experiences people have, even kids growing up in the same house. Those unique experiences seem to have the biggest impact on developing that fear of illness and the conviction you have in illness. Shared environment, like the general family atmosphere, seems to have less direct impact, surprisingly.
Interesting. What kind of unique experiences are we talking about?
Well, things like exposure to a lot of illness information, especially if it's alarming, maybe having a lot of focus placed on minor health issues during childhood, or experiencing a serious illness yourself, or having a close family member go through one.
Those early experiences can shape things later on.
They can. And having another anxiety disorder already, like generalized anxiety disorder, that definitely increases the risk too.
What about the world around us? Media, the internet? Does that play a role? We're swimming in health info these days.
That's a really relevant point now. How serious illnesses get portrayed sometimes as totally random, unpredictable, unavoidable, that can feed anxiety.
Sensationalized stories.
Yeah, or inaccurate risk information, or articles listing very vague symptoms and linking them to scary diseases. That kind of thing can definitely ramp up fears, at least temporarily for many people. And we certainly see spikes in health anxiety during major outbreaks or predicted pandemics.
Makes sense. Are there specific life events that can act as triggers?
Anecdotally, yes. Things like receiving a major medical diagnosis yourself or losing someone close to you from an illness, those can sometimes trigger the onset or worsening of health anxiety.
A reaction to trauma or loss?
Possibly. And there's also this interesting observation. Sometimes people develop health anxiety focused on a specific disease as they approach the age at which a parent died young from that same illness.
Wow, like a subconscious anniversary fear.
Something like that.
Yeah.
It really shows the deep links between our history, our losses, and how we perceive our own health risks.
Okay, let's shift to diagnosis. We know DSM-5 changed things, but how was it diagnosed using the older systems like DSM-IV or ICD-10?
Right. Under those older systems, the focus was squarely on that persistent preoccupation. The fear of having a serious illness based on misinterpreting symptoms.
What were the specific criteria for ICD-10?
ICD-10 required either preoccupation with at least 2 serious diseases, one named by the person, or a constant worry about having some kind of physical deformity.
Okay.
This worry had to cause real distress, lead to seeking medical help, and, crucially, the person had to persistently refuse to accept medical advice that there wasn't an adequate physical cause. And it couldn't just be during, say, a schizophrenic episode or a major mood disorder.
And DSM-IV, similar ideas.
Pretty similar, yes. DSM-IV also stressed the preoccupation with fears of serious disease, despite medical evaluation and reassurance. The belief couldn't be delusional, like they could acknowledge the possibility they were wrong, even if they didn't feel it.
Okay, not completely detached from reality.
Right. And it had to cause significant distress or impair their life, work, social life, etc. It had to last at least 6 months and not be better explained by another disorder like GAD, OCD, or depression.
Got it. And as we said, DSM-5 moved away from that specific hypochondriasis label towards somatic symptom disorder and illness anxiety disorder.
Exactly. A shift in focus.
Yeah.
But the core experience of that persistent, excessive health worry is still the central piece.
So given how distressing this is, what about treatment? What actually helps people manage health anxiety?
Well, the good news is there are effective treatments. Cognitive behavioral therapy, CBT, is really considered the gold standard here.
CBT. How does that work for this?
There's a lot of research, including strong clinical trials, showing it works well. It helps people identify those unhelpful thought patterns, the catastrophic thinking, the misinterpretations, and the behaviors like constant checking or avoidance.
Then challenge them.
Exactly. Learn to challenge those thoughts and change those behaviors. And the results are pretty good. About 2/3 of people respond positively.
2/3, that's significant.
It is. And maybe around half might even achieve remission, meaning they no longer meet the criteria for the disorder after treatment. Plus, the effects of CBT tend to last over time.
That's really encouraging. How is CBT usually delivered? Is it always one-on-one?
It can be flexible. Traditional face-to-face therapy, yes, either individual or sometimes group therapy can be effective, but telephone-based CBT has shown promise too.
Oh, remotely.
Yeah.
Yeah.
And also guided self-help using workbooks or online programs, often with some therapist support. Different formats suit different people.
Okay. Are medications ever used?
Yes, medication can play a role too. Antidepressants, especially the SSRIs, selective serotonin reuptake inhibitors, can be quite helpful.
How do they help?
They can reduce the overall level of anxiety and worry, kind of taking the edge off the intensity of the fears.
Okay.
And sometimes, maybe in more complex cases with severe anxiety or obsessive thinking, certain antipsychotic medications might be considered, usually the newer atypical ones. But that's generally less common and requires careful management.
So therapy like CBT is key, but medication can be a useful tool alongside it sometimes.
That's a good summary. A combination approach is often very effective.
Now, I'm really curious about the word itself. Hypochondriasis. You mentioned its origins earlier. Where does that actually come from?
It's fascinating, actually. The term hypochondrium wasn't originally psychological at all, it was anatomical.
Referring to a body part.
Yes. Specifically the upper part of the abdomen, sort of the soft area between the lower ribs and the belly button. It comes from Greek. Hypo means under, and chondros means cartilage, referring to the cartilage of the breastbone or ribs. So under the cartilage.
The area under the ribs.
Right. In later Latin, hypochondria just meant the abdomen.
So how did an abdominal region get linked to anxiety about illness?
It goes back to ancient medical theories, like the theory of humors. There was a belief that the organs in that region, the spleen, the liver, the stomach, the viscera, were the source of melancholy.
Melancholy originating in the gut.
Sort of, yeah. They thought vapors rose from this area to the brain and caused morbid thoughts and feelings. So for a long time, until maybe the early 18th century, hypochondria was seen as a physical disease caused by problems in the digestive system.
A physical imbalance leading to emotional distress.
Exactly. You see it in Robert Burton's famous book, The Anatomy of Melancholy from 1621. He blames hypochondria, the physical gut issue, for all sorts of physical complaints, from weird taste to bowel problems.
It's amazing how ideas change. When did it shift towards being seen as more psychological?
Immanuel Kant, the philosopher, made a really interesting contribution in 1798 in his book on anthropology.
Kant, what'd he say?
He suggested that the disease of the hypochondriac wasn't really about a physical illness itself, but more about how certain bodily sensations triggered fears of illness.
Ah, focusing on the fear response.
Yes. And he made this really insightful point that humans, unlike animals, can actually intensify or even create sensations just by focusing their attention on a part of their body.
Paying attention makes it feel stronger.
Exactly. And conversely, he noted, if you distract yourself, use abstraction, you can lessen or even make those sensations fade. It was a very early recognition of that psychological element, the power of attention in shaping our physical experience.
That's quite profound, especially for that time, the mind influencing the body's feelings.
Absolutely. It shows people have been grappling with this mind-body connection in the context of health worries for a very, very long time.
Well, this has been a really fascinating deep dive. We've gone from the historical roots in the abdomen through shifting diagnoses to modern treatments like CBT.
Yeah, it's clear that what we used to just call hypochondriasis is really a complex picture of excessive health anxiety.
And understanding has definitely evolved, moving towards concepts like somatic symptom disorder and illness anxiety disorder.
Right, trying to get more specific about how the distress manifests.
It clearly takes a significant toll on people's lives, thinking back to that life expectancy study. But it's really positive that effective help, like CBT, is available.
Definitely. Therapy can make a real difference.
So to wrap up, maybe a final thought for you, our listener. Considering Kant's insight about attention-amplifying sensation and that historical link between the physical hypochondria region and feelings of melancholy.
That mind-body link.
Exactly. How can we cultivate a kind of balanced awareness of our bodies? Noticing things without immediately jumping to worry, maybe thinking about that history, how physical location and emotional state were once seen as so directly connected, gives us a different angle.
A different way to think about how our minds and bodies interact.
Yeah. Perhaps it encourages a moment of reflection on your own relationship with health news, online symptom checkers, and just the everyday signals your body sends. Something to mull over. Thanks for joining us on this deep dive.